Only on Sunrise NBC5 News, continuing our partnership with Asante to bring you better health.
This morning, we're talking about a common circulation problem in the body and how it can be treated. We are back with Better Health, and I'm here with health expert Beth Coker with Asante. Thanks for being here.
Good morning.
And today we have Dr. Liu. We are talking about PAD this morning.
We're hearing more about peripheral artery disease as a serious condition that often gets overlooked in patients. What is PAD?
So PAD belongs in a family of cardiovascular diseases, predominantly affecting the lower extremity, the legs and feet, sometimes the hip and buttock area. And it's caused by accumulation of atherosclerosis or plaque in the blood vessels, predominantly the arteries supplying blood to the lower extremities. And when they're blocked, patients can have a host of manifestations such as pain, fatigue, and weakness, and things that are not totally related to joint issues, but can certainly affect someone's mobility.
Now, what are some of the things that cause this blockage in the lower extremities and the pain that results from that?
So risk factors for PAD are similar to that of coronary artery disease, something that perhaps our viewers are a little bit more familiar with. But cholesterol, smoking, and diabetes, hypertension, high blood pressure. These are all conditions that could lead to peripheral arterial disease and deposition of plaque. And then that restricts blood flow to muscle groups and to the lower extremities in general.
So once a patient is diagnosed with this, are there any treatments you can offer them?
There are many treatments. It starts with lifestyle modification, exercise, and most importantly, I think cessation of smoking, and that's really, really the key thing. So in addition to lifestyle changes, we can offer diagnostic testing such as angiograms, as well as treatments that are geared towards restoring flow to the lower extremities, and that includes surgery and, in appropriate patients, what's called endovascular repair or revascularization, using stents and balloons to remove the blockages in the arteries.
So the bottom line for these patients is help reduce that pain, do some behavior modification, and increase their quality of life.
Absolutely. I think that it's both a disease that affects people's quality of life, but also affects their longevity. The end result of peripheral arterial disease sometimes is gangrene and so-called critical limb ischemia. This is the very worst class of PAD, and that is an extremely mortal disease with a mortality rate higher than that of most cancers.
Wow. Thank you so much for being with us and sharing that knowledge.
Thanks for joining us. We'll be right back.